Hello everyone, welcome to Chartwell Retirement Residence. Today we're going to talk about patient-centered care. What are we going to cover today are what is patient-centered care approach, advantage, disadvantages, recommendations for implementation of the approach, and finally we're going to talk about feasibility of patient-centered care. First of all, let's talk about what is patient-centered care. Patient-centered care is focused on putting the needs of patients first by positioning patients or residents at the center of their care system. The Patient First Action Plan for Healthcare is Ontario's plan to transform the healthcare system by improving and working on the progress that has been made so far in healthcare in relation to patient care. Patient-centered care is aimed at increasing patient or resident health outcomes and their satisfaction with the care they receive to ultimately improve the quality of care. Patient-centered care is not limited to just patients in hospitals, but also applies to residents in long-term care homes. Patient-centered care promotes the involvement of residents and their families in making medical decisions while taking into consideration their environment, preferences, experience, and needs. It also requires communication between residents and providers to ensure that residents have the right information about their health and treatment to enable them to make informed choices and also provide feedback. Why do we need to implement patient-centered care approach? The healthcare system's primary focus is to improve the quality of care and overall population health outcomes. Chartwell Retirement Residence considers that each resident is unique and therefore requires care personalized to suit their needs. With patient-centered care at Chartwell, residents are provided with the quality of care they deserve by involving them in their care to ensure satisfaction and that their needs are met. If a resident do not understand why they are being treated or why they are asked to do certain activities that will improve their health, they may not want to be involved and the quality of care provided to them will suffer. Residents and patients need to be involved in all aspects of their care in order to improve their health and attain to what they really need. Therefore, healthcare professionals have to partner with their patients to truly understand their needs. Otherwise, the result will be poor quality of care. Now, let's talk about advantages. 1. Improved health and well-being. Enhance life satisfaction and quality of life. Provide better choices and decision-making. Reduce stress and tiredness. And improve operational performance. 2. Improve cost effectiveness. Reduce hospital expenses. Reduce the length of hospital stays. Enhance the discharge procedure. And time management. 3. Improve work environment. Also increase satisfaction with work, improve staff members' ability to respond to individuals' needs, reduce employees' emotional stress. Now, let's talk about disadvantages. Rising personal and financial expenses. It might be costly more than before, and risk are for individuals with poor decision-making abilities such as dementia patients and psychological illnesses. Staff personhood may be jeopardized. Compassion fatigue, unfairness caused by empathy. Evidence-based application of patient-centered care. Patient-centered care has increasingly become prevalent in healthcare settings. The goal is to prioritize patients' values, preferences, and needs to improve communication, satisfaction levels, treatment adherence, and overall healthcare outcomes. It gained popularity during this part of the century, particularly in the 1970s and 1980s. This shift was driven by movement advocating for rights, emphasizing patient independence, and a growing understanding of incorporating patient values and preferences into medical choices. Healthcare systems in developed countries such as the United States, Canada, the United Kingdom, and Australia have incorporated patient-centered care into their guidelines and practices. This approach has resulted in patient satisfaction, improved adherence to treatment plans, better overall health outcomes, reduced healthcare costs, enhance healthcare access, and reduce disparities in underserved population. Recommendations for implementation of patient-centered care and how to make it feasible. Conduct comprehensive resident-centered assessment to understand residents' unique needs, preferences, and goals. Training and support. Staff training and support to impart patient-centered care principles and communication skills. Encourage family participation in care planning and decision-making, leveraging their knowledge to create a collaborative care environment that aligns with resident preferences. Feasibility of patient-centered care. Implementing patient-centered care at Chartwell Retirement Residence is feasible due to its focus on individualized care. However, some challenges may arise, such as resource constraints, staff workload, and the need for cultural change. Overcoming these barriers through careful planning, adequate support, and continuous quality improvement can lead to successful implementation and improved resident experiences. Thank you. If you have any question or any feedback or any comment you want to share, please feel free to leave a comment. Thank you for now. See you next time.